Sleep apnea is a real big problem in the United States. And it doesn't just affect the obese old male with a big neck circumference. We find that sleep apnea affects a large portion of society. If you're constantly tired, even though you get enough hours of sleep, or your spouse is complaining about you snoring, or you might even already sleep in separate rooms because it's just not possible to sleep next to you, there's a high chance that you are suffering from sleep apnea. People usually don't know that they have sleep apnea because they're asleep while it happens, so they have no clue what's going on. Obstructive sleep apnea is a process by which at night the tongue and the palate, everything clogs together to where no air can get through the nose or the mouth down into the lungs. And then oxygen levels drop, but your body is asleep. In fact, it's deep asleep. That's why all the muscles that usually keep the jaw forward and the airway open have relaxed. So what happens is that your brain eventually notices that carbon dioxide is just building up in the blood. Stuff that you need to exhale is building up, and the oxygen you need for your brain and for your heart and everything is dwindling. What happens after a while is that you will go out of this deep sleep because your body is going into emergency mode because you're not getting enough air. Your sleep gets lighter, light enough for muscles to re-engage, you gasp for a breath, and then you fall back into that deeper sleep, and that whole cycle of not breathing and suffocating yourself can happen up to 60 times an hour. See, not only will it not give you restful sleep, it is not allowing your body to recharge and reset certain systems. We find that people who have sleep apnea also suffer from very high blood pressure, nighttime grinding, their diabetes gets worse, their life expectancy shortens, and their quality of life is really affected. You can treat it either with a CPAP device, which is a device that will push air into your nose and or mouth, or we can treat this now with what we call a mandibular advancement device, which is a very fancy name for a night guard that throws your lower jaw forward. So you're basically sleeping with your lower jaw in a forward position so that it opens up the airway.